Hey everyone, Dr. Rajasekhar here. Today we're diving into the pros and cons of male family planning, specifically vasectomy. It's a topic that often comes up in my practice, and I want to make sure you have all the facts before making such a big decision. Let's break down everything you need to know. Alright, let's talk about the elephant in the room. When it comes to effectiveness, vasectomy is right up there with the best of them. We're talking over 99% effective in preventing pregnancy. Think of it this way, once you've had the procedure and you get the green light from your doctor, you can pretty much say goodbye to those worries about unplanned pregnancies. It's a game changer for many couples. No more daily pills, no more awkward moments before things get hot and heavy, just peace of mind knowing that you're in control of your family planning. But remember, while vasectomy is incredibly effective, it's designed to be permanent. One of the things that surprises a lot of my patients is how straightforward a vasectomy actually is. We're not talking about major surgery here. It's usually done right in my office or a clinic setting, and the best part is, it's done under local anesthesia. That means you're awake, but you won't feel any pain during the procedure. And how long does it take? Well, from start to finish, we're talking about 15 to 30 minutes, tops. Now, I know any kind of procedure can sound a little daunting, but trust me, this is one of the easier ones to recover from. Most guys are back to their normal routines within a few days. Let's talk side effects because, let's be real, that's a big concern for anyone considering a medical procedure. Now, when you compare vasectomy to other forms of permanent contraception, especially female sterilization, it really comes out on top. And here's another thing guys will appreciate. A vasectomy doesn't mess with your hormones. That means your testosterone levels remain the same, your libido is unaffected, and everything else downstairs keeps on functioning as it should. Let's be practical for a moment, shall we? Contraception, especially in the long run, can put a dent in your wallet. Condoms, those monthly trips to the pharmacy for birth control pills, it all adds up. But here's the beauty of a vasectomy. Once you've had the procedure, that's it. No more ongoing costs, no more subscriptions to worry about. It's a one-time investment in, well, not having kids. Think of all the money you'll save. Money you can now spend on other things, like that vacation you've been dreaming of, or maybe a nice dinner out with your partner. Now, this is a question I get asked a lot, and understandably so. Guys want to know if a vasectomy will affect their performance in the bedroom. And the answer is a resounding no. Remember how we talked about vasectomy not messing with your testosterone? Well, that's key here. Your ability to get an erection, your libido, your sexual pleasure, none of that changes after a vasectomy. It's simply a matter of preventing sperm from being released during ejaculation. Everything else, all the good stuff, stays exactly the same. So rest assured, your sex life is safe and sound after a vasectomy. Okay, so we've talked about the positives, but it's important to address the risks too. Now, with any surgery, even a minor one like a vasectomy, there's always a chance of complications. But here's the good news. When it comes to vasectomies, those complications are pretty rare, and they're usually minor. We're talking about things like a little bit of bleeding, some swelling, or a mild infection. These can usually be managed easily with antibiotics or some over-the-counter pain relievers. Of course, it's crucial to choose a qualified and experienced doctor to perform the procedure. One of the biggest advantages of vasectomy, especially when you compare it to female hormonal methods like birth control pills or implants, is that it doesn't mess with your hormones. See, those hormonal methods can sometimes cause unwanted side effects, mood swings, weight gain, you name it. But with vasectomy, you bypass all of that. Your body continues producing testosterone and other hormones just like it always has. Now, this is where it gets real, folks. Vasectomy is intended to be a permanent form of contraception. It's not like other methods where you can just stop taking a pill or remove an implant. While there is a procedure called a vasectomy reversal, it's not always successful, and it can be quite expensive. The success of a reversal depends on a lot of factors, like how long ago you had the vasectomy and the specific technique used. So, before you take the plunge, it's super important to be absolutely certain that you don't want children in the future, like really, really certain. Okay, so we talked about how the vasectomy procedure itself is pretty quick and simple, and how most guys bounce back quickly. But like with any surgery, there's always a bit of a recovery period. You might experience some discomfort, a little swelling, maybe some bruising around the incision site. And you know, some guys might have some mild pain for a few days or even a couple of weeks. But here's the thing, it's usually nothing that a little rest, some ice packs and maybe some over-the-counter pain relievers can't handle. And the good news is, it doesn't last long. This is super important, gentlemen. Even though a vasectomy is incredibly effective, it's not like flipping a switch. It takes a little bit of time for it to become, shall we say, fully operational. After the procedure, there might still be some lingering sperm hanging out in your semen for a while. So, you can't just ditch all other forms of contraception right away. Your doctor will usually want you to come back a few months after the procedure to provide a semen sample. This is just to make absolutely sure that there are no swimmers left in the pool, so to speak. Okay, so we talked about how vasectomies are generally very safe with low risks of complications. And I always want to be completely upfront with you guys, there's always a small chance of long-term side effects. Now, I want to emphasize that these are rare, but it's important to be aware of them. Some men experience what's called post-vasectomy pain syndrome, where they have pain that persists even after the surgery has healed. This can range from a dull ache to a sharper pain, and it can be really frustrating. The good news is, there are ways to manage this pain and it doesn't affect everyone. We've covered the physical aspects of vasectomy, but it's just as important to talk about the emotional and psychological side of things. This is a big decision, guys, and it's not just about your body. It's about your future, your family plans, everything. Some men, even if they're initially sure about their decision, may experience some regret later on. Life throws curveballs, relationships change, and sometimes priorities shift. That's why it's so important to have open and honest conversations with your partner, to really think about your long-term goals, and to consider all possible scenarios. Now, this is a big one, gentlemen, and it's something that often gets overlooked. A vasectomy, while incredibly effective at preventing pregnancy, does absolutely nothing to protect you against sexually transmitted infections or STIs. Just like any other form of contraception, except for condoms, a vasectomy doesn't offer any barrier protection. So, if you're not in a monogamous relationship, or if you're unsure about your partner's sexual history, it's crucial to practice safe sex. Now, while vasectomy is a great option for many men, it's not a one-size-fits-all solution. There are some instances where it might not be the best choice. For younger guys who are still on the fence about having children, it's generally recommended to explore other options first. And of course, there might be some medical reasons why a vasectomy isn't suitable for everyone. It's always best to have a frank conversation with your doctor, go over your medical history, and explore all the available options before making a decision. So there you have it, guys. The pros and cons of vasectomy laid out for you. It's a safe, highly effective, and permanent method of contraception for men who are sure they do not want children in the future. The procedure is relatively simple, has a low risk of complications, and doesn't affect your sexual function. However, it's crucial to remember that it's intended to be permanent. Think it through carefully, weigh the pros and cons, have those open conversations with your partner, and most importantly, talk to your doctor. They can help you make the most informed decision for your individual needs and circumstances.